active activity, running, walking, and nothing in large groups. That takes place this coming Saturday morning. What we're showing here on the screen is a copy of the Parks Declaration from Mayor Kirk Caldwell for Honolulu Parks opening up this coming Saturday. Take a look at passenger arrivals. People still do continue to arrive in the islands, both visitors and returning locals and also intended residents. Let's take a look at the arrivals and some issues that have come up. Now, some Big Island visitors were arrested. They had arrived Tuesday from Washington, checked into a hotel there on Banyan Drive, and were seen outside of their hotel room. They were reported to police on Wednesday, and they were located at the hotel pool, not in their room as they are supposed to be, have been quarantining. Those arrested are Matthew Young, age 27, Caleb Conrad, age 39, and Mackenzie Anderson, age 24, and also a citation in addition to that for a 39-year-old woman. So this is an example of local authorities taking those quarantine orders very seriously. People can and do still come to Hawaii, but they need to stay quarantined. Those folks were not. Here's the most recent arrivals yesterday. Another 166 Hawaii residents returning home, 109 visitors, and 46 people classifying themselves as new residents came in on 12 flights yesterday. All 321 of them, just like all the ones before them, will have to serve a 2-week quarantine either in their place of hotel lodging or at their home for a resident who is returning. As the mayors have made clear, at least Mayor Kirk Caldwell here in Honolulu, vacation rentals do not count as an essential service. These visitors should not be staying at bed and breakfast and vacation rentals. Now, Scott Murakami on the hot seat a lot these days. He is the director of the State Department of Labor. They're the ones administering the unemployment fund that hundreds of thousands of people have been trying to tap into, not just to file initial claims, but also to go in and recertify their weekly claims on a system that continues to bog down. We had him on Wake Up today and asked him some questions about what's going on with unemployment. Here's what he had to say.
If we're still waiting for unemployment claims to be processed, will we miss out on the federal $600 per week stimulus for unemployed people and receive back payments from the date of separation?
Good morning, Ashley. Thanks for your question. I will tell you that you will not miss out on the $600 plus up. You will be able to get it. We will process your back pay, but it won't be from separation of duty. Soon it'll start from March 29th when the program became active. So if you were laid off after March 29th, then yes, you would get the full amount. But if you're laid off before then, it'll start from the week of March 29th.
Okay, Jerry Lynn wants to know, now that I finally got the ball rolling with unemployment, I am unable to continue to file weekly because I am unable to get logged in due to the high volume. This counteracts all the work that we put into just to make an initial claim. Can the weekly, bi-weekly filing be waived until further notice?
Jerry Lynn, I apologize for the high volume that we're having. You know, I've tried on a number of times to see if we could waive the weekly or bi-weekly certification, and unfortunately we're not allowed to do that. That's actually an issue of our fiduciary duty to the trust, and it's our way of determining that the individual still remains unemployed. So as much as I'd like to do that for the claimant's benefit, I also am unable to do it because of the fiduciary responsibility we have to our trust.
Okay, Keiko Lemondahl wants to know about claim certification. What if we haven't been able to log into the website for days? Will that affect our claim when we can't get in to do our weekly certified claim?
Okay, Keiko, you know, so I'm going to let you know this, that theoretically, the way the system is set up is that after 3 weeks, if no one is able to file a claim, then technically the account goes inactive. So I've instructed our staff to remove that. They told me that it's buried deep down in the code, but I told them to find a way to remove it because I don't want anybody's claim being inactivated. But what I will tell you is that you will get, once you're able to certify, you will get all of the back pay that you're entitled to. And right now, the issue I'm working on with our staff is making sure that nobody gets inactivated.
And what the director's talking about there is not just getting certified to get your initial claim in correctly, but to have to go in week by week and to tell the department, did you work or not? Did you have any income or not? And a lot of people around the state waiting to get an actual check, money either in hand or through their direct deposit. Now, the director of the Department of Labor did also address some of the common mistakes that they continue to see when it comes to initial claim filings and things that you, if you're the ones there at home trying to get on these systems and trying to get in and do it right, here's some very important tips from the Department of Labor on mistakes they see and things to be sure to be extra careful to do right. Take a listen.
What is the biggest mistake that you're seeing on these claims that are holding things up?
You know, there are a variety of things that we see coming in. A lot of it is the employer data needs to be corrected, and as well as things like the start date of when they started employment or the start date of their claim. And that could be like, for example, I think it was Yuko who had asked that question. And you know, that's the kind of clarification that we need to get. It's typically been, you know, the employer, it's been the date of separation, start date of the claim, the start date of employment, because a lot of times people may have been in job for a long time and may have forgotten about those sorts of things. So it's hard to remember, you know, when I actually started, but it actually, the system actually validates that. And that's why it's been very challenging for the public to have to wait through that, because they think that they've got the right date, but then they realize, what, it was a couple of days off or something like that, right? And you can imagine the frustration on the part of the community. So those are typically the types of errors we've been seeing.
And we're shifting now to Mayor Kurt Caldwell's press conference.
Good afternoon and aloha. I want to thank everyone for gathering here in the mayor's office at Honolulu Hale, a little bit different setting than our other biweekly press conferences. So wanted to just very quickly run through some statistics. As you know, the report today was very positive for Oahu, just one case for the entire state of Hawaii. And I think everyone is doing an excellent job of following all the orders, the stay-at-home orders, the quarantine orders, the mask-wearing requirements, everything in between. And it's showing as a result that we're making a tremendous difference. If you could go to the next slide. So I did want to talk about this. You know, there's been a lot of questions as we talk about reopening our society as to what happens as we go forward. And on Tuesday, we talked about a gradual reopening and the fact that our stay-at-home order will remain in place during these gradual phases or opening up of different categories of businesses. And if there's no order in place, then there's an immediate opening up of everything. If there's an order in place and it moves forward month by month with fewer things in place that are determined non-essential and become essential with modifications, we can protect ourselves from seeing a spiking of this virus, which remains in place until we have a vaccine, and that's going to be a while before that occurs. So I wanted to point out this slide because it's the Spanish flu that impacted our country back in 1918, 1919, during the ending days or ending year of World War I. As you can see, there's a couple of bumps, and they call this the death bumps, because what happened is you saw the initial occurrence of the Spanish flu. People got strict. It brought down the curve, and then they loosened up, and there was a spike, and then it came back down, and then it bumped again. We don't want to live through this in our city and county of Honolulu, and we do not want to have people who come out and start to celebrate their lives like they did before, and then they're forced back in. And that'll be very difficult for all of us to do. Next slide. This one actually shows Spanish flu in Denver. So Denver actually recorded their interventions and what happened, and it was a double-humped curve. So they had the first cases like in September of 1918. They did interventions. It continued to spike, and then because of interventions, it dropped. And then they removed it thinking, hey, the coast is clear. We can come back out again and celebrate life. And it spiked a second time and even higher. And then it came back down. We want to avoid this. We want to avoid this at all costs. It's extremely important. Next slide. So we want to talk about reopening. And basically, we're using two types of measurements to decide when you reopen. The first one, we call it the environment assessment. Not an environmental assessment, but an environment assessment. And it's based on 4 categories that we've talked about in previous press conferences, including the one on Tuesday and even last week. And the first one is the epidemiology. Cases. Is there a steady drop? Is there a flattening of the curve? And as you could see from the slide that we showed earlier, there is definitely a flattening of the curve, and we're seeing a steady decrease and a holding steady in terms of number of cases. The second part of our environment assessment is the healthcare system. How many ICU beds do we have? How many respirators do we have? How many hospital beds do we have? And we want to make sure there's sufficient number of these types of things so that should we see a little bit of a bump, it's not going to endanger the public. The third one is the public health system. That's testing and contact tracing that we've talked a lot about. We're going to talk about again today. And making sure we have facilities available for quarantine. And then the last one is social readiness. That's the physical distancing, the wearing of face masks or face coverings, washing of our hands, doing all the things that we've been doing, and does the public continue to hold steady on this throughout this period? And in some ways, it's a little bit like our weather report. We're going to be looking at this every single day, and we do. I know all the mayors and the governor, we wait to find out what is the number of positives every single day. I know I ask quickly, have you gotten the report yet? When I get the report, I say, how many cases on Oahu? Because I'm concerned about our island. I'm concerned also about the state of Hawaii. And this is going to continue every day during the remaining period of this pandemic until we have a vaccine. How many cases? But then it's also, how are we doing on ICU beds? Because if we start to open up and there's more elective surgeries, some of these ICU beds will fill up with patients who are having surgeries that are not absolutely necessary, but they're coming forward and getting done. And that can impact the number of beds we have. And of course, we got to be careful about that, particularly if you see a little bit of increase in some COVID-19 patients have to go into it. And always making sure we have sufficient facilities for isolation and quarantine if necessary. And how are we doing every day? Are we all wearing masks? We see in the streets, in the cars, and all kinds of places that people are wearing masks. And do we continue to practice that good social distancing? But the other measurement tool, besides the environment assessment, which is kind of our weather report, and one other thing on this, is it's kind of like the weather report. It's pretty accurate going 1, 2, or 3 days out. It gets really hard to predict the weather 7 days out. And so we're looking at this every day, and we kind of know what the next day may look like, but it's hard to predict out too far. And that's why when we talk about opening things up, it's opening things up and taking a breath and watching and looking at the weather report to see what's happening. And if we see sunny days and not storm clouds, we continue to open up more things. But the other factor we look at, if we could have the next slide, is a risk assessment. So one is the weather report, the environment assessment, and the other one is the risk assessment. And these are activities that are based on the level of contact and the ability to modify those conditions. So a risk assessment runs a gamut from very low risk to very high risk. And it doesn't mean that some of these things that are at the higher end of the risk assessment doesn't mean they couldn't open up sooner as long as they do the modifications necessary to mitigate those risks. So this is not A to B to C to D to E to F to the end of the alphabet. Things could move around depending on the type of modifications that are done. And a lot of times it's about physical ability to modify, and there's sometimes a cost factor in there. So, when you talk about things like low risk, parks and botanical gardens are very low risk. And we are opening our parks this coming Saturday at 5 in the morning for exercise only, because there's very low risk to go in the parks and just exercise. And on May 1st, we're opening up our botanical gardens to, casual walking through the botanical gardens. And both of these are low risk, but they're also based on decisions and recommendations made by our medical advisory group that says people need to get out of their homes. They need to be able to exercise in open spaces where the chances of coming into contact with each other are minimized, and you get to restore your health. Wearing masks where possible. If you can't because you're jogging, you have a health condition, you can't. But then we've also talked about, aiming towards May 1st for golf courses with a lot of limitations. Car dealerships, and real estate transactions by appointment only with a lot of limitations. Everyone wears a mask. When you go to an open house and only one person in the open house at one time, other than with the broker. And certain other businesses that can use remote customer interface, for example, music lessons. You could have one pupil in a room with the piano teacher, pupil at the piano, the teacher 6 feet away instructing the student on how to play the piano. And there's many different types of situations like that. But if we have low risk with modifications to address the risk factor, we open up earlier. And so these are examples of things we think we can open up earlier. Next slide. Then you have things that are more medium risk, but with modifications, perhaps they're less risky. So we talk about things like retail stores with measures in place for physical distancing. It could be by square footage, for every 1,000 square feet, a person is in the store. And of course, everyone is wearing a mask. And you're clicking people in and out to make sure you never are too crowded. Pet grooming, maybe by appointment, and your pet is there, but you're not there. You drop the pet off, it gets groomed, you come and pick up your pet. And of course, office environments with measures in place for physical distancing is something that's being practiced here at the City and County of Honolulu and other places. And then outdoor, when we say malls, we mean outdoor, kind of shopping in a mall setting, but you're managing the number of people within the open air part of the mall. Okay, next slide. And then you have high risk with modifications. So there are things that are just high risk, more difficult to deal with, like restaurants with measures in place to reduce density and other things. And in fact, while this is a higher risk, for example, with restaurants, if they can put in place all the modification measures to reduce this high risk and make it a moderate risk or even a potentially low risk, they could actually be opened up earlier. And we're working hard to see what kind of things can we open up earlier, because we recognize that business is struggling. They're hanging on by their fingernails, and they can't hang on forever, and they can't even maybe hang on beyond a month or two more. And 70% of the business on Oahu and in the state of Hawaii is small business. They are the infrastructure for business here, and we want to make sure that that infrastructure is around after we come out of this pandemic. Beauty parlors and nail salons, with social distancing, you can mitigate that risk. Gyms and yoga, Pilates, those kind of things, you could mitigate the risk to some degree, but it's still high risk. And religious gatherings outside of the place of worship. So large gatherings, where it would be Easter Sunday service, sunrise service, those kind of things. Got to figure out how to manage that high risk. Next slide. So there are certain things that are just really hard. They're high risk and hard to modify. Bars, not so much. You could have people sitting at every other stool or every 3 stools, but after a couple drinks, they start forgetting how to practice good social distancing, and they get closer together, and you have problems. You have the bartender exposed, so there's things that need to be addressed there. Running, races like marathons or walkathons, where you have a lot of people gathered close together, is going to be more difficult to modify. Of course, concerts, conventions, and sporting events where you have a lot of people gathered together, sitting together in front and back of each other, it's really hard to do that. And of course, then unrestricted religious gatherings of a large number. So these are more difficult to modify. So again, as we do this, as we look at our type of business to open up, we are always looking at a weather report. We're always looking at the environment assessment every single day. And then we're looking at the risk factors, and if we can modify the risk, then we could look opening up sooner. And of course, as we do this, we're constantly testing, aggressively to find out, are there cases out there? Are there any clusters? And what do we do if we find them? And that's why we need to be very vigorous in our contact tracing, and we need to be ready to help take those folks who are tested positive, if they can't be protected in their home, to be protected somewhere else, so that they do not pass the virus to others. And if we do all of this, we can continue to move forward in a steady manner and open up more and more business. And we watch as we go, and we watch how people are performing and whether there are any problems. So I can't stress enough how important it is to continue to test the whole way along and to look at our 4 factors that we're concerned with, our weather report. So again, as I mentioned, we opened up our parks. We'll be opening them up on, this Saturday, Botanical Gardens on May 1st. We're looking at golf courses with limitations, car dealerships with appointment-only basis and no test driving, automated car washes. Businesses can conduct operations in a more remote way, interface, and grave site visitations are things we are looking at trying to do as early as May 1st. But before we make the final decision, we're taking these recommendations to our medical advisory panel to get their input. And with the input they provide, perhaps we can add additional conditions to make sure that everyone is protected as we go forward. And then medium risk modifications, as I mentioned, we're looking at things like retail stores, pet grooming, and office type environments. High risk with modifications, again with requirements of social distancing. We're looking at remaining components of park facilities, perhaps barbershops, nail and hair salons, gyms with limitations. And then there's the high risk and difficult to apply modifications part, which we talked about, large sport venues and concerts and that kind of thing. So again, I want to repeat, this coming Saturday at 5 a.m., we'll be opening our parks for exercise only. That means walking, jogging, bike riding only. And we ask people, the parking lots will be open so people can drive to the park and park. We're asking folks to wear face coverings, if at all possible, and practice good social distancing. This is not about gathering. And there's no use of the tennis courts or basketball courts or play equipment. And again, all of these things have to be done with good social distancing. We're not yet ready to open up Coco Head Shooting Range or Hanauma Bay or off-leash dog parks, but that could be on the horizon. So in conclusion, as we had up here, just to reemphasize always, it's about testing. And we want to do more testing. We want to be pragmatic about it. We want to be active about it. We want to have a targeted approach. And of course, when you find a positive, we're protecting them from spreading the virus to others, and we're protecting our kupuna and homeless community. And finally, physical distancing. With that, I'm going to open it up to questions on opening up our community again.
And you can follow along with the question and answer portion of this press conference on our website at khon2.com, where our coverage will continue of this afternoon's press conference. Again, that's Mayor Kirk Caldwell going over what he's calling the first phase of reopening parts of Honolulu. Specifically, the parks will reopen this Saturday morning. He also outlined the plan for unveiling more and more things through a steady process that would assess low, medium, and high-risk settings where modifications can be made to ensure social distancing. A few examples he threw out were car dealerships that could start to do some degree of business, maybe not the test drives, not a long or large group there at once, but by appointment-only sales. Remote car washes, things like that, he said, could continue. And again, when you do use the parks this weekend, it's for walking, jogging, bike riding. It is not for using any kinds of courts. No swimming in any of the park pools. Those will remain closed, but you can park in the parking lots, bring a face cover, try to use that. Don't come in groups and keep the social distance. Please stay tuned to KHON2 for coverage of all of this and all of the day's news, starting with our KHON2 News at 4. See you then.